Before we finish up, I really wanted to make sure that I shared some things about the currently available vaccines. The first two vaccines that were released, those by Moderna and by Pfizer, the so-called mRNA or messenger RNA vaccines, have generated a lot of concern, a lot of discussion. And I want to give you some simple pointers on just where things stand and a lot of the misinformation that's being shared out there. Let me focus on three simple points. The first one is looking at a variety of sources, including parties that have a vested interest in this, that, one of their main kind of reasons for existing seems to be, concerns about the rights of the unborn. These messenger RNA vaccines have no fetal parts in them. There was nothing in the design or manufacture of these vaccines that had anything to do with fetal tissue. Okay? So I've seen that in a couple of very good sources. So I'm very comfortable that we're not having to be worried about that concern. Now, some of you say, well, I wasn't concerned about that anyway. Well, then let's talk about some of the other things that people are concerned about. A second concern that people have, is it going to alter my DNA? It is true. This is using related compounds to DNA, messenger RNA, ribonucleic acid, very similar to the deoxyribonucleic acid, the DNA, but very different actually, and the way it's handled in the cell very differently. So this messenger RNA does not go into the nucleus, the part of the cell where your DNA is stored. So there is no plausible way that this messenger RNA should change your DNA. So a number of individuals have looked at this. I've heard a number of experts address it in the medical community. No scenario that anyone knows of where this is going to affect your DNA. So I don't think that's a reasonable concern at this point either. The third concern, and this is a huge one for many people, and that is that there are some kind of micro tracking devices, nanobots or other things that are going to be used to track you if you get one of these messenger RNA vaccines. And here's the simple truth about it. Let me just make it very, very simple. First of all, from all the ingredient lists and all those who've looked at the vaccine, no nanobots in there. Yes, there are nanoparticles, tiny particles that are the way that the messenger RNA is being introduced into the bloodstream to protect it from the immune system so it can get into the cells. So there are these microscopic, microscopic particles, but they don't have tracking devices. Now let me make this as plain as possible, because folks say, oh, well, they just didn't tell you that it's they're not going to put it in the ingredient list. Let me make this as plain as possible. And this will remove this question from, because I've heard this with other vaccines too. And let me just tell you when it's total nonsense, when you can know it is total nonsense. And here it is when you have what we call multi-dose vials. Multi-dose vials. What this means is many of these vaccines are produced in such a way that a vial will have more than one dose of the vaccine. Maybe in a little bottle, there's 10 doses. You immediately know there's no tracking device. You say, why? Think about it. If there's 10 doses or 50 doses or whatever, however many doses in a vial, how is the nurse going to know which tracking device to pull out of that multi-dose vial? There's no way. Okay? You can't do it. You say, oh, well, they threw a 10-dose vial, they threw 10 micro tracking devices. Well, what prevents the first time the nurse draws it up, or the doctor, or the medical assistant, or whoever's giving you the shot, the pharmacist? What prevents them from pulling up 10 nanobots and putting them into the first person so they have all 10? The point is, it just does not work. It's not logical. It's not practical. It's impossible that anyone can dose nanoparticles, give you specific nanoparticles from a multi-dose vial. So that should end the discussion right there. great confidence that I have in the data I've seen. You do not need to worry about anything tracking you as a result of these vaccines. So I've tried to address the three most common objections that people are raising, okay? Now, I'm only talking about two vaccines. There is no the COVID-19 vaccine, which most people ask me, Dr. DeRose, what do you think about the COVID-19 vaccine? There is no the vaccine. There's multiple vaccines. I've just told you about the first two that were released in the United States, the Moderna vaccine and the BioNTech Pfizer vaccine, okay? So, what about the big question? Should I get the vaccine or not? And at this point, I'll tell you, looking at the data on the vaccines and looking at the ravages of the virus, and some people say, hey, I don't know of anyone who's, gotten very sick from this. It's always just... I know personally of people that have died, people very close to me that have died, okay? So this is not just a bunch of hype. And it's because of the virus in the cases that I know about, no question about it, okay? So this virus is killing people. And if you're in a high-risk group, right now, my reading of the literature, pretty clear, the risks of the vaccines, and there's always, don't let anyone tell you there's no risk to a vaccine. Anytime you give an injection, there's some risk, okay? The risks of the vaccine in high-risk people right now, from my looking at the literature, are small compared to the potential benefits. So I'm recommending, in fact, just had couple of people that I know well in their 80s that called me and asked me what they should do. And I told them just what I'm telling you right now. I've told my parents who are in that high risk age range, get the vaccine. The risks of the vaccine seem to be quite small in high risk groups, quite small in relation to the benefits of the vaccine. Now, if you're 18 years old, you're perfectly healthy, and down the road you're wondering whether to get the vaccine or not, then you're going to need to make that decision based on things like, well, is it being shown to prevent people from transmitting the virus if they get exposed? And you're living with some older relatives. Maybe that's going to tip the balance for you. But it's a much more difficult situation. These are newer technologies. We're still waiting to see, how everything plays out. But right now, if you're in a high-risk group, to me, pretty clear decision from my vantage point that the risks of the vaccine relatively small compared to the potential benefits of protecting you from COVID-19, which it seems to do, both of these vaccines, in a very, very high percentage of people. I didn't think this video would be complete without getting outside, especially in view of what we're dealing with in northern Indiana right now. Actually, you may be able to tell in the background, getting a bit of snow, but earlier today, we had an ice storm. It was really dangerous to actually just walk out to your car. Right now, this looks pretty manageable as I'm walking over to our vehicle here. And earlier this morning, this car, boy, I didn't know if I could even open the doors. And probably unless I've actually unlocked them, we're not going to get in. So let me do that. But it would have been dangerous just to have walked out here earlier in the day. But okay, we got things opened up here. Wow, you still got some of that ice and snow on the windshield. What this all has to do with vaccinations is a car provides really a great setting to make some very important points. Well, first of all, if I'm getting ready to leave, you got it. I'm going to put this seatbelt on. I've been around for a while, but those who were in public health before me said a lot of what's being discussed in the vaccination debates today reminds them of, well, some of the discussions in the public health community about these things. There were folks when legislation was being discussed about requiring people to wear seatbelts. Folks were saying, hey, who is the government to tell me that I should wear a seatbelt? If I don't want to wear a seatbelt, why should I wear it? It's possible some of you still feel the same way. But let me tell you the interesting thing. I don't put a seatbelt on every time I get in the car because there's a law to do it. I put a seatbelt on to protect myself. And I encourage my passengers, my family members to do the same because I love them and I care about them. My first point in this vehicle is simple. Make the decision based on vaccinations, not based on whether someone's requiring you to do it, but is it in your best interest to get the vaccination? What I'm suggesting when it comes to the mRNA vaccines that we've been talking about, the research suggests that for high-risk people, just like wearing a seatbelt, we're all high risk when we get behind the wheel of a car. When it comes to COVID-19, we may not be all at high risk, but if you are, getting the vaccine seems like a really good idea. But let me take the illustration one step further. Back to this interesting scenario with the ice storm that we're dealing with, and also with my windshield. I'm not going to clear that windshield off because the government said I can't drive if I don't have an unobscured windshield. I'm not clearing it off because I'm afraid I'm going to be penalized if I'm caught driving with ice covering my windshield. I'm going to clear it off because that's the safest way to drive. And so when it comes to the COVID-19 vaccination, I encourage you individually, forget about what anyone's telling you to do. Forget about whether an airline says you can't board a plane without the vaccination. Hasn't happened yet, but that day may be coming. Forget about whether it's tied to some kind of stimulus check or not. Ask simply the question, what's best for me and for others around me? We'll get there in a minute. And that brings me back to our seatbelts. Got my driving gloves on right now, so I'm ready to give you an illustration with this seatbelt on of driving. Because some people say, well, why can't I just do what I want? Leave the seatbelt off. Okay, so the seatbelt's off, okay? Coming off. And if I get hurt, it's my own fault. It's on me. And no one else is bearing the brunt of my problems. So I'm driving along, okay? Of course, not with the window all covered up. And I'm just sitting here in my driveway, if you will, parking lot. Somebody pulls out in front of me. Young man with a couple of children in the car. He's distracted. Pulls right in front of me. I'm going 55 on a rural highway. Pulls right in front of me. I try to evade him, but I can't. There's a crash. I'm hitting the brakes. Next thing you know, I'm flying through the windshield. I'm dead. Okay? In this scenario, I'm dead. I'm laying dead, bleeding, severe head injury, affected my brainstem for the sake of discussion, not breathing at all. I'm dead. Okay? Laying there dead in the middle of the street, just beyond this fellow's driveway. Blood all over the street. His two kids see it. He sees it. Yeah, it's my own fault. I wasn't wearing a seatbelt. But, he was the one that caused the accident. He pulled out right in front of me. How is he going to feel? How are his kids going to feel? Here's the point. Even when we think something is just affecting us, other people are affected by decisions that we make that can cut our own lives short. One other illustration behind the wheel, okay? Do you realize that I've been in positions where in order to see patients, I've had to drive many miles? True of many of my colleagues as well. I once was working in a clinic several hours from where I lived. I would drive out there, spend several days there. I was working in an underserved area in our country. And driving on the roads is dangerous. Some of the trip to that clinic, winding, fast, rural highways. Dangerous. Here's the interesting thing. From what I'm seeing of data from the messenger RNA, the mRNA coronavirus vaccines, those made by Pfizer and Moderna, the risks of my getting behind a wheel and driving, well, at least on a consistent basis, looking like a whole lot more risky than getting the vaccine. You say, well, what's the point? You got to drive, but you may not need to get the vaccine. Here's the point. Why was I driving those long roads? I was driving to go help other people. See, here's the thing. Here's the other part of the vaccination discussion that we can't leave off. And that is other people are impacted by the decisions I make. Let me go back in time with you. As a physician, for many years, I was working with low-risk people. I was doing lifestyle medicine, working with generally healthy people, trying to improve their lifestyles, trying to get rid of addictive behaviors. I was not dealing with the intensive care unit population. I was not dealing with really sick people. And I didn't see a need to get the influenza vaccine. Now, the reality is, if you're healthy and you're exposed to influenza, you're going to be able to fight it off. You will likely not get sick. You will likely have an inapparent or asymptomatic infection, just like we've been hearing with COVID-19, but you can pass that infection to other people. So, when I was in a setting where I was working with higher risk people, what do you think I did? I got the influenza vaccine, knowing that with any vaccine, there is always some risk. You can't take a pill, you can't get a shot and have zero risk. You could have an allergic reaction. You could have some weird reaction. Your body could just not like that particular vaccine. I'm never going to tell anybody that there's anything you can inject yourself with that is 100% safe. I don't care, even saline. Okay? The technique can be such that you get an infection from even a saline injection. Okay? Here's where I'm going with this. Why did I get the flu shot? It was to protect my patients. That's the other reason that I think the COVID-19 vaccination should be on our list. If you're a health professional and you're listening to this message, think about other people. You may not get sick, but if you're not vaccinated, you may be at higher risk of getting the infection and passing it on to other people. Yeah, there's still a lot we don't know. And if you focus on all we don't know, yes, you can make an argument saying, hey, we don't have all the answers. We better just wait. Don't vaccinate anyone. Let's make sure all the answers are in. I can guarantee you, people are going to die, people whose lives could have been spared by this vaccine. And I'll tell you, you got to make the decisions, the best decisions you can, realizing that, yes, sometimes we're exposing ourselves to some risk, but you know what? Whether the government tells me to do it or not, I'm putting the seatbelt on. And it's the best for me. It's the best for other people that may be around me. This vaccination, for a lot of us, it's the best thing to do. It's the best thing for people around us. Think about that as you're processing the data on the COVID-19 vaccinations. Well, hopefully that answers some of the questions about the vaccine. And hopefully, this presentation has given you some practical strategies to enhance your own immune system and make a difference in the lives of those that you love. Again, I'm Dr. David DeRose. You can find all of my resources at compasshealth.net. But a couple of special things that I offered you in this video, you've got to go to the special address. You can't just navigate there. Look down at the information below. Remember the free Evading Ebola book with a lot of immune system pointers, a lot of interesting history. That's available at compasshealth.net/Ebola. And then that free handout, extensive handout, helping you boost your immune system, compasshealth.net/sanctuary. And of course, don't forget my free 30-day program, 30 Days to Natural Diabetes and High Blood Pressure Control. You can get it on YouTube on my Compass Health Consulting page, or simply go to compasshealth.net, navigate over to the section where I talk about resources, and go down to Help for High Blood Pressure. You'll see links to those free videos right below the illustration, right below the picture of my book, 30 Days to Natural Blood Pressure Control. Success and optimal health. That's my wish to each one of you.